Good morning, everybody. My name is Hannah Arolu. I'm the Dean of International Education at Lambton College here in Sarnia. I'm very happy to see everybody again. I'm sure you guys are all getting excited as the time nears by for the January 6th start date of your semester and your orientation happening on January 2nd, 3rd, and 4th. I'm happy to be here with my friend, Lucia Quigley, who is from GuardMe directly. She's here to provide information regarding your policy, your early arrival policy, your regular policy, all the inclusions and exclusions related to your health insurance that comes from our third-party provider, GuardMe Health Insurance. But before we get started, on special occasions like this, I would like to read a land acknowledgement. I would like to acknowledge that Lambton College in Sarnia is located on the beautiful homeland that is the traditional territory of the Ojibwe, Potawatomi, and Adawa First Nations. These three individual nations make up the traditional Three Fires Confederacy. We acknowledge the grace and the welcome they have offered to all students and staff at Lambton College. Okay, wonderful. And as we will proceed today, Lucy is going to have a presentation, and she has really good information related to your policy and how it applies to you and your dependents, etc. So please refrain from asking any questions, but if you do, you can post your questions in the comment section. And then as we go through the presentation and near the end of the presentation, we will have that Q&A session where we can answer those questions. But again, pretty much everything that Lucia needs to say is going to be in her presentation. So over to you, Lucia. Thank you.
Thank you so much, Hannah, and welcome everybody. I appreciate your time and attending this session today. Like Hannah was saying, my name is Lucia Quigley, and I manage the account and partnership with Lambton College and GuardMe. So without further ado, I'm just going to give an overview of the policy, exclusions, inclusions, how you can provide and extend this service to your dependents. So GuardMe welcomes you to Lambton, welcomes you to Canada. We're all getting excited about this new adventure, and we really work together to make sure that your stay here in Canada is a safe and healthy one. So if you ever get sick, become injured, or need assistance, medical assistance, please just reach out to us. We're here to help. Keep in mind the GuardMe is your emergency healthcare plan, okay? So although you don't have a provincial health insurance, you have GuardMe to support you while you are attending full-time studies at Lambton. This slide, it can be sometimes a little bit daunting, scary. Please don't. That's not the purpose of it. It's just to make you aware that if you didn't have coverage in place, you will be facing these fees. Yes, it is expensive for someone who doesn't have health insurance to access the healthcare system in Canada. Contrary to some myths, healthcare system in Canada is not free, and it's quite expensive for those who have no health insurance. Now, if you are planning to bring your dependents with you, keep in mind these fees because the dependence coverage is not mandatory, as it is the plan itself for all international students. So it's up to you to make sure that they are properly covered. Now, insurance is a very, forgive me, it's a very, it's not a very exciting topic to discuss, but it's a very important one. It's very important that you understand that your GuardMe at Lambton policy has a lot of benefits that I'm not going to read because there is a summary that is available digitally and in a hard copy. But I want to read to you the most important ones, the ones that will make you understand that you will have coverage for if you become sick, ill, for hospital, physician, any surgery or any testing that is requested by the doctor, 100% eligible charges. So you don't have to worry about any of those fees if you become sick or need a medical assistance. If you need prescriptions, you have up to 60-day supply. There is a psychotherapy benefit for up to $2,000. The ambulance, if you need one, it's important to understand that if you go to out of Canada for a short trip, you will be covered. Especially to the states that is a very close proximity to Sarnia in particular, or if you're in Ottawa as well, you can probably cross by and spend a weekend, or why not? If you become sick in the States, the only place that you are not covered is if you go back home and you become sick at home. The policy will not cover you there. Dental up to 5,000 if you have emergency dental, and then you need to relieve a pain as well. The policy also includes a contraceptive coverage for $40 every 30 days. And a very important addition to this policy that was added as well is if you have a chronic condition and you need to require the maintenance for it, you have up to $10,000 per year to maintain such chronic condition. If you have any questions, and again, there are more benefits to the policy, way more benefits, both emergent and non-emergent benefits. But I think the purpose of this presentation is to let you know where you can find the information related to your specific needs, and to explain to you what is an emergency benefit. For example, you can see it on the screen here. There is three columns, and the first two columns are emergency benefits, like I mentioned, or hospital x-rays. Maybe you need a dental injury, you need medical equipment supplies, or you are out of Canada and you need to seek a doctor, etc. Now, there are some non-emergent or non-emergency benefits that are also included in the policy. For example, you need to go and check your eye prescription. So you have one annual exam that will cover you up to $150 for a non-emergency eye exam. And there are more like that, okay? You have an annual physician visit. For example, if it's not an emergency case, but you need to go and get checked by a doctor, you have up to $200 to go and seek a doctor and get that treatment checked after. Now, the non-emergency benefits, usually you have to pay out of your pocket and then submit a claim for a refund. The emergency benefits, we have a network of providers where you can access the services, the doctors, the hospitals, and you don't have to pay for the visit in most cases. I will explain how that works, but I just wanted to let you know that in the case of the non-emergency benefit, like the annual exam, like the contraception coverage, you probably have to pay out of the pocket. Keep receipts at all times to ensure that you will receive the money back afterwards. Like in any insurance policy, there are exclusions. And for example, any treatment that is not medically necessary is considered an elective treatment, or a cosmetic surgery will not be paid for or covered by the policy. A non-prescription medication, what would that be? Vitamins, maybe some supplements, over-the-counter medication, for example, Tylenol, Advil, Pepto-Bismol, etc., as well as the contact lenses and glasses. Yes, you do have the benefit to check your prescription, but the actual glasses or contact lenses will not be covered by the policy. I mentioned this earlier. If you go back home for a short period of time, maybe a short break or why not, and you become ill, the expenses made because of your illness in your home country will not be paid for. Very important. Yes, if you are in an aircraft or traveling as a passenger and in a commercial flight, you will not be covered. And this is a very important exclusion that sometimes we oversee and overlooked, is if you get into an accident because of an abuse of a drug of alcohol intake. You are highly intoxicated, and then you become, whatever the case, you had to go to the hospital for to get you better in that condition. We have the right to deny that claim because of the intoxication caused by drug of alcohol. So just be mindful when you are using the substances. It's not about the legality of using them. It's about the state that they might take you to that will cause the claim to be denied. How will you access these benefits? Lucia, how am I going to get my policy? So it's my understanding that the information, Hannah, just interrupt me if I'm wrong here, but it was sent to you already. You are going to receive it via email. So you have to action that email. You have to, when you get the welcome email from Garmi, and I want to explain a few slides down the road, but this is what you are going to see. Once you follow those steps, open your Garmi account, download the policy, you're going to have a one-page document. At the top is going to be your emergency healthcare access card with your information on it. kindly review it. Take a minute or two. Make sure your date of birth is correct, that your spelling of your name and last name are accurate. This could cause problems at the moment of direct billing. At the moment that you present your insurance and then the provider, dentist, or otherwise says names don't match, the claim was denied, is because sometimes the spelling is not accurate and doesn't match your passport or the way the school enrolled you. This is the proof of your insurance. Please keep it with you at all times. Make sure you have both a hard copy, a paper, and a digital photo in your phone. A majority of the hospitals and medical providers, they don't like to see the health card on your phone. They like to see the paper. So we'll suggest that you have both options available to you. Moving along. So you will receive the email. You will receive an email and to activate, to download your account, your Garmin account. This is just a screenshot of the dashboard. This is what it will look like once you open your Garmin account. And please make sure that you look at your address. Make sure that, again, you look that all your policies are accurate. If you have dependents, it will show in here. If you have any claims active or pending or in process, it will show also in here. In the red arrow, you can see you can download the healthcare access card, and that's what you need to do. So make sure, this is just a quick overview of what you have to do when you receive the welcome email. And voila, this is just a screenshot of what the welcome email will look like. Please, you have to, I'm not below begging at this moment. You need to action this email. You cannot let it sit because you need to have that information ready. Now, it's very important once you have that sorted, once you have downloaded your card, when you have your Garmin account open, that you understand how the healthcare in Ontario works. There's a triage system that is in place. Perhaps it's not how it operates in your home country. Certainly is not where I was born and raised. But we need to understand that in Canada, in Ontario, we don't go to emergency rooms for minor illnesses. We have both the pharmacy, we have mobile doctor, which is, I would say right now, your new best friend, available 24/7 for any emergency, any non-emergency, any illness, sickness, or symptoms that you're having. But the pharmacies in Ontario, they can actually give you these prescriptions on the spot. So if you walk in there with whether a pre-consult or just a regular walk-in, they can give you the medication for these minor illnesses as is now. Now, I already mentioned, sometimes they cannot, maybe you have something else that is not listed in the slide before, then you have to go to a walk-in clinic, make an appointment, and get your condition solved. What we are trying, and the message here is, you have avenues. There's a triage. You call mobile doctor, which I just explained how that works in 2 slides down the road. You go to the pharmacist, or you go and make an appointment to the walk-in clinic. By all means, if you are experiencing a severe pain, if you are bleeding, if you can't breathe, if you have high fever over a day or two, you have severe pain, you are in major critical condition, you broke a bone, you were in a car accident, we are not trying to tell you go and call mobile doctor or go to a walk-in clinic. You will be taken to the hospital immediately because this is an emergency. What we're trying to alleviate is for you to sit at the hospital, at the emergency room for hours on end, because you will not be taking care of that strep throat at the emergency level. And the system is strained enough. We are in lack of a lot of doctors and nurses. So whoever goes to the emergency room is because it's in critical condition. So keep that in mind when you decide where to go, which provider to take. And if you don't know, totally understandable. That's what we're here for. That's what our customer care is for, to guide you through your situation. So this is, I like it to call it our best friend Why? Because mobile doctor is a virtual care available to you free of charge. It's included in your benefits. It's part of your benefits. You can access any time of the day, any day of the week, anywhere in Canada. So maybe you are in Sarnia, you're in Ottawa now, but you are traveling to Niagara Falls. Maybe you're in Toronto. Whatever you are, you can call a doctor and say, I'm bleeding, I have pain, vomit, whatever the case, they can tell you what to do. They can prescribe medications. They can refer you to blood work and so on. Please, once you get your policy number, sign up for your mobile doctor account. It's very important that you do that. As you can see in the screenshot, it's very easy. You can access through a laptop or through your phone. I personally like the phone because it's easy. I can be anywhere just accessing. I just mention my symptoms. I get paired with a doctor or a nurse practitioner. And if I need medications, they can even locate or send it to my home within one business day, or they can be located to a nearby pharmacy. So you save time trying to go to a walk-in clinic or to a hospital or to the pharmacy. Just calling mobile doctor. And the call might last between 5 to 8 minutes. Is really highly rated because it's really convenient. And I want to touch some important topic here is another myth that we have from an international student perspective coming to Canada is the healthcare in Canada is fantastic. It's really easy to access. It's top notch. Unfortunately, that's not really the case. We even Ontario residents with OHIP holders, we have sometimes challenges trying to get in front of a doctor. So having a virtual doctor at your fingertips when you need it, it will become very handy, especially in the winter time, when it's already a challenge just to go outside and maybe wait hours on end for transportation or get to a hospital or get to the walk-in clinic. You can do that. 5 to 8 minutes. That's 1 or 2 songs that you wait while you get connected to a doctor or a nurse practitioner, and your issue can be solved right away. So like I said, why not? It doesn't cost anything. It's very important that you realize that both teams at Lambton, Ottawa, and Sarnia are fantastic to, give you assistance. We have campus ambassadors on call also as well, providing information. But at the end of the day, if you have a particular condition that you want to clear, that you want to check out, that you want to confirm coverage, kindly connect with our customer care team. Because of privacy reasons and so many other things, we need to connect with you directly to make sure what your question is and to answer properly your concern. Especially if you're planning of going to a hospital. So before you're being admitted, kindly give us a call because we need to liaise with the administration of that hospital to make sure that you don't get an invoice. Another scenario is when you go to the walk-in clinic, when you go to a doctor, and they give you some requisitions to go for MRI, maybe an X-ray, maybe get some blood work, whatever. Before you go and pay any money out of your pocket for any testing, kindly confirm the coverage with our customer care team. This is just a Lucia advice, a Garmi advice. Before you pay anything out of your pocket, confirm coverage. You don't want surprises. That's all I'm saying. So kindly follow this advice to the most of your ability. Okay, so I mentioned at the beginning that I was going to give you some information where you can find all the details of the policy, where you can read the whole policy from back to end. And these are the websites. So we have created 2 custom sites, one for Lambton, Sarnia, and one for Lambton, Ottawa. Kindly just go into those links, make them your favorite. In here, you can access your current policy. You can download it. You can, once you have your policy, you can add your dependents. If you are about to graduate and you need to extend or purchase another policy, you do it through here. If you're planning of arriving early, Hannah and I were going to touch base on this. You have 30 days before your start date that you have a a policy covered or a coverage in place, but you need to select it through here. It's free of charge. So please do that as well. You can submit claims. So let's say you pay anything out of your pocket and you have the receipt. By the way, if you pay anything out of your pocket, on top of keeping the paper trail, the paper receipt, take a picture of it. The reason why is if you lose that receipt, unfortunately, there is no way to backtracking, and we cannot pay if you don't have a receipt in place. If you need to find a Canadian clinic to go in person, this is also the place where you find it. Mobile doctor, kindly go through the link given to you, because when you open your mobile doctor account, you have to link your GARMI policy number with it. If you don't do that, you are going to be charged for every time you connect with mobile doctor, and that's not the right way to do it. You should not be charged for accessing mobile doctor. Summarizing, please make this custom site your favorite. In here, you can add your dependents. You can purchase your early arrival policy if you are graduating. I'm not using the case, but you can also purchase policy afterwards. My account is where is the button on the left drop down menu where you are going to find the most frequently actions that you are going to take with regards to your policy. You find and review the documents in multiple languages. You can download your card, submit claims, and you can review the status of your claim. So just a screenshot that you can find that information in the custom site. Canadian clinics near you, also in the same links. Just another reminder that all the information is listed in the custom site. The best way to make a claim, especially now that we're going through a little bit of a hiccup with our Canada Post service, is online. Make sure that you submit your claims online, that you attach invoices, receipts, and everything that you have paid for in that claim submission. How are you going to get your money back? Well, especially right now, the best way is through a MasterCard. You're going to receive a link first via email, and then you receive the hard copy via mail. In this case, if we navigate what's happening with Canada Post, but you can also get a direct deposit to your Canadian bank account, a bank wire transfer, or a check. And how long will it take? Between 5 to 10 business days. From the moment we have the full claim completed. Please keep an eye on your inbox. That's what I said at the beginning. Make sure that when you go into your account, your GARMI account, you check that both email and telephone numbers are accurate, because we might have to connect with you in the case that some information is missing in the process. So yes, that's the time frames that it takes to pay you back for the money you have. You have paid for your claim. Just a little for housekeeping here. Just a reminder that a claim form has to be completed. You cannot leave the spaces blanks, like policy number, name, date of birth. We need to know who are we paying. Are we paying you, the student? Are we paying the hospital who gave you the bill? Are we paying your friend who paid on your behalf? And how are we paying? All that information is clearly stated in the form. Kindly selected which way you want it to go. Reminder, you need to attach scan invoices from the healthcare provider, any doctor's notes, anything were given by the doctor, please add it into your claim. And be specific about the reason for the visit, not just say I was sick, just say what was the symptoms kind of thing, proof of payment, and make sure you sign and date the form. Please ignore the days that was the first, that was the last intake. Hannah, we're going to say December 1st, right? For
December 2nd.
December 2nd?
Yes.
As early as December 2nd, you can go click onto your custom site and select your early arrival policy if you are arriving a month before the start date of your program.
That's correct.
Apologies for the editing here, but it should be all set for December 2nd.
Yes, and we already sent an email to all the students in Sarnia and Ottawa coming for January with that information of prior to December 2nd arrival arrival between December 2nd and December 31st, and then the information related to when the annual coverage will be provided, which is at the end of January.
Excellent. All right. Just the last item that I already mentioned is, as part of the partnership we have with Lambton, your family can access the same policy as you. Just keep in mind that it's up to you to purchase coverage for them, because they are not automatically included in your policy. You can purchase, once you receive your policy, you can go into the custom site and purchase a policy for each member of your family, spouse and or children. Again, same custom site. If you haven't selected or saved the link, please do so now. Take a picture or whatever is easier for you. Just a little bit of a news. We have a partnership with Rexel, and as a GARMI policy holder, if you can receive up to 20% off regular price brands when you use the link. They have a preferred perks app. It's called the Be Well app card. So if you download it and open it, if you use the GARMI code upon registration, you can access the 20% off of these brands. So again, a little bit goes a long way. 20% is just great incentive to use this brand and this partnership. Our team also, our GARMI offers great. It's a student connection. It's part of a team of students that are on the ground, are part of our GARMI team, and they sort of communicate to other peers what GARMI is doing, how to engage, how to communicate to the students what the benefits, what to do in most cases. It's a peer-to-peer program. Is not paid. It's not a paid position. It's a volunteer position, but it will give you a lot of ground to create your resume, to get you going in the Canadian employment scene. It gives you recognition, it gives you activities. It's a great way to actually get involved into the college, to meet new students and way more. So if you're interested, just scan the code and you'll be connected to the campus ambassador manager, and then you can start your process to be part of the team at Lambton. Before I say goodbye, before I close the presentation, I just want to let you know that we are also launching the GARMI app. You can find it both in the Apple Store and the Android, and it will help you facilitate having all the information, submit claims, and why not through your phone. So that would be like the last news, but also just for an emergency, this is the toll-free number. If you have any questions, I'll strongly suggest that you send an email to customercare@me, and kindly just save these links for your future reference, or any other questions you may have. It's probably already easy to find in that custom site. So that would be all, and then we're going for some questions.
Yes, absolutely. Yes, thank you, Lucia. As I mentioned at the beginning of our presentation, Lucia is going to come to you with lots and lots of information, very useful information. So thank you, Lucia, for your time and great information that you've provided related to GARMI. It is a lot of information. It's very complicated. Last week, we also sent the policy link to you, to our Ottawa and Sarnia students. And, the word legalese, where it's very complicated, it is, but it's very important that our students read what the policy covers before they come to Canada, so they understand the exclusions and the inclusions. We also have exclusions, things that are not going to be covered. So if you are going to need that assistance, then you would need to seek additional coverage from your home country before arriving to Canada. So it's very, very important that students do read the policy, understand the inclusion, the exclusions, and it's not just about accidents and things like that. We also have the non-emergent care that Lucia talked about, students that are with contraceptives and with other Lucia, can you give me some other examples of the non-emergent care? There's a wart removal of up to a couple $100. There's a
Yeah,
lot of things.
the immunization.
Yeah.
Maybe the annual physician visit. Maybe there's a condition that you need to get checked up, and then you can access that benefit. There are other, the non-emergent would be maybe if you have asthma, why not? And that's a non-emergent, into the non-emergent benefit as well.
Absolutely. So students sometimes just think it's only if there's an accident, but the Hampton College, you would say, with GuardMe, has one of the most extensive coverage programs of Ontario colleges. Would you say that, Lucia?
Absolutely. And also some people, because this is another myth that we have as an international student coming to Canada, is like, oh, the provincial coverage is fantastic. Actually, it's not. Unless you are employed and you have employee benefits, OHIP will not give you medication. Like, you get sick, you have to pay out of your pocket.
That's a really good point. You make a really good point, Lucia. Like, students, once they start working, they think that they can opt out of GuardMe because they have OHIP. OHIP doesn't cover a lot of the things that GuardMe covers. You can't go to the eye doctor when you have OHIP. You can't go to the dentist if you don't have a company plan. I don't want to talk about repatriation. You know, we've had incidences where we've had to repatriate students back to their home countries. That is not covered. So it's quite extensive. Again, I encourage you, please read the policy, understand your policy. And if you do have dependents meaning children and spouse, those additional dependents can be added to your existing plan with GuardMe before you arrive, and then if you arrive just soon afterwards. So we have a couple of questions here. Ivo says, good morning. Good morning, Ivo. Mayor is asking us, where can I find a list of healthcare providers who accept my insurance? Good question. Lucy, did you want to answer that?
Yes. So I mentioned that you can go into the custom site, whether you are attending Sarnia or Ottawa campus, and going to find a Canadian clinic. You can type your address or your postal code or intersection, and it will provide you a list of providers part of the network. That's the easy way that I would suggest. The second would be you can call customer care, and they can tell you where to go according to where your location is. Now, the other thing is, it's important to understand that you have the freedom to, one, use our providers, so you don't have to pay for the visit, but we're not forcing you to go to those providers if you don't have a provider nearby, because you have to understand that Canada is a very wide country, and sometimes we work in rural areas where there's no doctor around. You can go to any provider. You must have to pay for the visit, keep the receipt, and then submit the claim. That's usually, so you have both options. Always keep in mind that before heading to a doctor, because I understand we want to talk to a doctor, but the reality is the trend that we're facing here is that is getting more and more the case. Now we're getting, like, I haven't seen my family doctors as a case example in the last 2 years. Everything's over the phone. If it requires for them to see me, then I'll get an appointment, God knows when. But it's not the common. It's not the rule to follow these days. So we're trying to move into the virtual visits. So please, before, if you have to go in person, please do so. But 5 minutes, you can get connected with mobile doctor, and they can probably help you in way less time than going and moving and getting transportation and going to whatever the place that you are heading to. So just keep that in mind.
You just raised really, really good points here, Lucia. 2 main points. Number one is our students have free access to mobile doctor. You and I don't. If we have to get this access, we have to go through the provider, which is Maple, I believe.
$90.
$90, where yours for our students is covered. So if you're feeling sick, if you're feeling, especially if you're sick, like the flu or any other conditions, the worst thing that you want to do is put on your clothes, get into, take public transportation, go to the emergency room, because that's where most of the students will be going, because they don't have a doctor. On average, I would say, you're going to be waiting 4 to 8 to maybe even 10 hours in the waiting room, depending on the time of year, especially during cold and flu season. Whereas you could be in your pajamas at home on your laptop, connecting with your mobile doctor. And mobile doctor can provide prescriptions. Yes. And on top of that, the pharmacy can deliver those prescriptions directly to your home. So it's very important that students are aware that they have this service. But once they get their health access card, when they get that email from GuardMe at the end of January, first thing they do is they set up their profile. The second thing that they do is create their profile for Mobile Doctor, because when we're feeling great, we don't pay attention to health insurance. But when you're feeling really sick and not able to perform is when you're going to have to access that. And if you haven't set it up, then it's going to take you longer to do so.
I wanted to say two things, Hannah. That's a great point. One is Mobile Doctor will take your call any time of the day, and statistics data shows that we get sick after 4 p.m. and weekends and holidays. There is no walk-in clinic. I will take you. It depends where you are. You're lucky if you have one. I'm serious. I'm not trying to scare you, but it's very rare. So you can get your issue solved that night when you start feeling that strep throat coming out. And two, if you have a and this is from a personal advice, if you have a medication that is your go-to when, for example, I have sinus infection, it's ongoing, and I have my specific medication over the counter that I use all the time. If you have something like that it works for you, make sure that you bring one or two of those with you, because that might tie you over during the break, during the winter season. And you might not find the same medication here in Canada. So if you are really fan of a specific, medicine, cough, whatever, a headache, migraine, just bring it with you so it can help you navigate those first symptoms, at least you get your feet on the ground and know what to go. It's just what I would suggest.
And what Mayor is asking too with help, where can we find the healthcare providers? So let's say you're the students, for the Sarnia students, for example, there is a brochure on the My Lambton website. So when they go into the My Lambton Sarnia students, they'll find a provider for dental, for doctor clinics as well. For Ottawa students, we don't have that because it's a bigger city. So they would go onto the website and put in their postal code or the location. But when a student goes on co-op, they could be anywhere in Canada. They could be in Newfoundland, they could be in British Columbia, they could be in Alberta. And let's say they're on their co-op and they need to seek assistance. They need to find a healthcare provider or a pharmacy. They can also do that, click it in, and then it will show the nearest provider and pharmacy wherever they are during that time. Perfect, thank you. Next one. Mayor's also asking, what happens to coverage after I graduate or if my study permit expires? So Lambton College, many years ago, decided to provide annual coverage for our students. So you guys are starting January 1st, and your coverage will be going until December 31st, 2025. A new policy will be emailed to you in January of 2026, and that will take you to December 31st, 2026. So Lambton College students are protected during their breaks and during 4 months after graduation. I believe we are one of the only institutions that does this, understanding that when you graduate, you may not have a job right away, and we don't want you to be exposed. And, we don't want you to have to pay out of pocket. So you are in an annual coverage during your breaks and during your co-op, one project, obviously you're a student, and 4 months after you graduate. And I believe, Lucia, after they even graduate, there could be a provision for them to extend.
Absolutely. So I think I mentioned twice during my presentation. In the custom side, when you go into it, you see recent grads. So if your policy, and I'm going to make up a date, expires December 31st, or August 31st, 2025, then you have a month, I believe, for you to go into the site, enter your current policy or the one that is about to expire, and purchase a recent grad policy. It's not the same one that you have. It's not the same GuardMe at Lambton. I believe it's GuardMe Canada, which provides enough coverage for you to stay. I think it's up to 6 months coverage that you can purchase after graduating.
That's fantastic. Thank you. Okay, Shay is asking, good morning. If you pay half of your tuition fee, will you still be able to get the full insurance? So Shay, I believe you're referring to you've paid half of your annual tuition. So you've paid for your winter semester, and then you're within the next few months until April, you're going to be paying your second half of your studies, which would be from May to August. Yes, definitely you'll have the coverage for your annual coverage that you will be receiving at the end of January. So yes, doesn't matter if you paid half of your tuition, half of your annual tuition, you'll still have the coverage. But that's a different issue, a different question of when you need to pay for your tuition. And all that information is on the important dates. I also wanted to, so thank you, Shay, for that question. I also wanted to re-emphasize and reiterate what you were talking about, Lucia, with your ambassadors. The GuardMe ambassadors we have at both study locations, and it is a volunteer opportunity where a co-curricular record, a CCR, is provided to the volunteers. But they also receive great training from GuardMe, and it's a great connection with the student body on campus. They are talking about the policy, they're talking about where to access the information, how to submit a claim. I think it's a great opportunity. So if there are students on the call today that are interested in becoming a GuardMe ambassador, please reach out to your WhatsApp ambassador that we have on our WhatsApp groups for the 25 winter. Or you can also email orientation@lambtoncollege.ca, and we will connect with you as well. Our team will be promoting the ambassadorship, so I'm sure that we're going to get new ambassadors starting in January. We're always looking for ambassadors because as students move on through their studies, they go off on co-op or they graduate, we need to replenish our ambassadorship. So it's a great volunteer opportunity. It looks great on a resume, and it's a good way to meet new students on and off campus. Again, just to remind students to, once they receive their email from GuardMe, so Lambton College will not be emailing you at the end of January. It will be GuardMe emailing you to your My Lambton email account. So it's very critical that you continue to monitor your My Lambton emails as you register and as you start your classes on January 6th. So you'll receive an email directly from GuardMe asking you to set up your account. And then once you do that, you follow what Lucia said, download your health card, print it off, put it into your wallet, and then you would set up your mobile doctor. And again, we've got the new app, which is wonderful. It's the app will be in your pocket, it will be in your phone. We'll be able to access all that information as well. Coming up, we have our orientation week on January 2nd, 3rd, and the 4th at both study locations, and we will have either Lucia or Brad in the Ottawa location presenting again this information to you. So it's very important that our students are aware that there is coverage, that it is extensive. It is one of the best policies within the province with Lambton and with GuardMe. So seeing that we don't have any other information coming from our questions here today, I'd like to call it a day and thank Lucia for all of her wisdom and information related to GuardMe.
Thank you. It's a pleasure always.
I'd like to thank Eric, who is our producer at the back end. So thank you to Eric for hosting us today on StreamYard. And I'd like to thank our students for taking all this information. Again, if you have any questions, reach out to two locations, orientation@lambtoncollege.ca, which is your provider for all information related to your onboarding, or to your WhatsApp ambassadors that you're connected to related to your study location and program. So again, thank you, Lucia. Thanks, everybody.
You so much. Take care.
Bye-bye.